And now, I will just see the glimpse on how I'll prepare the gowning and the gloving before assisting to delivery. So first, I'm opening the pack of gown and the towel, and then I rub the gloves I will use in assisting the delivery, and throw the pack. So next, I do the surgical hand washing to minimize the transmission of microorganisms, and now ready to top my hands with cloth in order to dry. And then, now I'm ready to pick my gown and making sure it is still sterile. And I have assistant to close my gown. Staying your things in sterile is the most important thing. And here is how I wear my gloves. So I unwrapped it and making sure I didn't touch any sterile part of the gloves. So I twisted my hands and adjusted it to fit in. And making sure not to touch any sterile part, which is very important. And the next hand, I did the same thing. Ta-da! And it's all done. Why is keeping a sterile field important? These set of practices that are performed before, during, and after invasive procedures reduce the number of potentially infectious microbes. One of the things to do is to prepare the OB pack. We call this the outer lining of the pack. You can touch the outer lining with your bare hands. Once it is open, you cannot touch the inner lining, so you have to use the forceps and then adjust. So another thing to prepare in assisting the delivery is preparing the OR pack, which consists the linens used to cover the pregnant. So first, cover the both legs of the pregnant patient and make sure not to touch the sterile part. Next, put at the abdominal base and then the perineal base. And done. Now, in this table, the nurse will prepare the materials needed for the delivery, according to the sequence. First thing we will give to the doctor is the bandage scissor used to cut the perineum to have a wide opening. Then after the baby is delivered, the assistant nurse will prepare the Kelly forceps or the curved forceps to clamp the umbilicus of the baby. And next is the straight forceps, but it is optional. And then the surgical scissor, next needle holder, and then the kosher. In opening the syringe, make sure not to touch it. Just easily tear the pack and drop the sterile part. Next thing to add in the cord clamp. So in the opening, you have to tear it as indicated, but be careful not to touch it and easily drop it at the sterile part. After everything, arrange the drop materials and put the syringe at the very first. Since it will be the first used, or it will be the used first to inject at the perineal area before delivery, and after preparing everything, you're good to go. This is how you prepare the needle and thread used to suture after the delivery. You will put the needle at the third teeth of the needle holder, give allowance for the needle, and then lock it. If the dominant hand of the doctor is right, then the pointed part of the needle should be facing at the left direction, and then vice versa. This is how you fold perineal support. Divide it into three and fold it, and you're going to insert your hand in the perineal support. Hold the thigh of the patient and support the perineum until the baby is fully out, and drop the perineal support when the baby is delivered. This is how you will going to serve the syringe with light at the chloride, high the chloride 2%, and remove the needle cover and serve it and give the OS. After using, recap the syringe in scooping technique and place used OS near the placental bag. Next, Serve the bandage scissor. Be sure the holder of the bandage scissor will be touching the palm of the doctor, and make sure it won't cause pain at the palm of the doctor. Then clean the bandage scissor after use. When the baby is delivered, serve the junction bulb.